Welcome to Limitless Lives. In today's episode, we delve into the transformative world of lifestyle medicine with a leading expert in the field. Our guest today is Dr. Sejal Desai, a double board certified family medicine and obesity medicine physician based in Houston, Texas. With over 20 years of clinical experience, Dr. Desai's pioneering work focuses on empowering individuals to achieve lasting health and vitality through evidence-based lifestyle modifications. As a board member of HOPE, which is Houston's Obesity Partnership for Excellence, and the VP and co-founder of Human Physician Entrepreneurs of Houston, Dr. Desai champions the empowerment of women physician entrepreneurs, fostering innovation and collaboration with the medical community. Join us as we explore the key factors that contribute to optimum health outcomes and learn valuable insights on how lifestyle medicine can unlock a path to vibrant well-being. Without further ado, please welcome Dr. Sejal Desai to the show. Dr. Desai, welcome to Limitless Lives, and thank you for being here.
Thanks so much for having me. I'm so excited to have this conversation with you today.
Well, great. Can you start by explaining what is lifestyle medicine and how it actually differs from traditional medicine approaches?
Yeah, that's a really good question. Lifestyle medicine is a medical approach that uses evidence-based behavioral strategies to prevent and treat chronic disease. So we use the strategies of nutrition, physical activity, quality sleep, stress management, avoidance of risky substances, and social connection. And the focus there is on prevention for lifestyle medicine. Traditional medicine, our focus is more on treatment of disease. But as an obesity medicine physician, I'm so lucky because I get to use the best of both worlds to combine those principles of lifestyle medicine and traditional practice and really be able to offer more of a comprehensive, holistic approach to patient care.
That's fascinating. When you say comprehensive holistic care, what does that look like in reality?
Yeah. So it's really about taking the whole patient into consideration. So no matter what it is that we are dealing with, whether it's a physical ailment or a medical condition or weight or whatever it may be, there are so many different processes going on in our body, right? It's not just that one particular thing. So looking at a patient just based on their one medical condition or, symptom is really not the best way, in my opinion, to practice medicine. We really want to look at everything. What is their lifestyle like? What is their family history? What does their nutrition look like? There's so many different things that we want to look at to really help treat that condition. So we're really looking at the big picture.
I'd love to explore that a little bit more in terms of what you feel are some of the most crucial factors in helping individuals achieve optimal health outcomes or improve their health through lifestyle modifications.
I think first and foremost is your mindset. It was Theodore Roosevelt who said one of my favorite quotes. It's believe you can and you're halfway there. So we have to be able to visualize it. We have to be able to see our progress, and then only can we truly invest in it. I think that that's really important where we are with our mindset. I have a lot of patients who can be really frustrated because they've tried so many different interventions for weight loss and it just hasn't worked. And so sometimes they can get really frustrated, but I think it's a little reset that we need to do before starting and make sure that we are truly in it and believe in it. And then number two is really making it a priority. So anything that we want to accomplish, we have to make a priority in our lives. There were studies done in the past where people are asked, what are the most important things in your life? Rate these things. And family and health almost always end up number one and two. So if health is important to you, then make it a priority. Spend the time, the resources, not only to improve your health, but really to optimize it. This, I think, is the only way that, we'll be able to be around to care for our families, which is the other top priority of ours. So I really do think that those two factors are absolutely critical in no matter what we're talking about with health.
It's so fascinating, isn't it? When you say about the mindset and we want to see instant results. And when that doesn't happen, we move on to the next piece that we think that will help our well-being. How do you play that into the picture?
Yes, absolutely. We live in a society of instant gratification, right? We want our Amazon package delivered in 24 hours or less, and we want our weight loss done in, 2 weeks or less. Everybody's trying to do the right thing. Sometimes we just lose our way. And I think it's the doctor's job to discuss all of this with the patient, talk about it, get them to refocus and understand. In my case, things like the weight didn't come on all at once, having these conversations that we want to do this in the safest way possible. And that's not going to be the fastest way possible because you can have certain side effects, right? If you lose weight too fast. So I think it's really just about that communication between the doctor and the patient and really for patients to be able to voice those concerns that they have with the doctors and then doctors being able to guide that. So I think that for me that's crucially important to be able to do that.
You mentioned there needs to be some dialogue between, say, an individual and their doctor. You also talked about the education piece around that. I'm wondering for our listeners how then they can make more informed decisions about their health and lifestyle choices to promote overall well-being and vitality.
Yeah, so that's so important, so incredibly important. As a human being, whatever's going on with you, you are the expert on it, right? I think the first thing is educate yourself. Whatever it is that you're dealing with, educate yourself on it. Make sure you're getting your yearly physical. This is the time to discuss prevention with your doctor. What are your risk factors? Are you up to date with all of your screenings for your age and family history? A lot of patients tell me they don't see the doctor because they don't need to. They're well. But that's the main time to see the doctor so that you can prevent the long term complications. So it's very important to make sure you're getting your yearly physical with your primary care doctor. And in this day and age of technology, I just think it's so important to use it wisely. It can be such a double edged sword. Social media is wonderful if you're looking for things like plant based recipes, and you follow a dietitian that's giving you plant based recipes. Wonderful. It may not be the best source for your medical information. There are a lot of us on there who are doctors giving the information. So I think that's different, but be cautious where your information is coming from when you educate yourself.
You talk about education and the whole mindset piece. For people that really struggle with this, there's all these inputs out there. How do they essentially reduce some of the noise and the confusion to really help them plan for what they need to do? Does it start with self-awareness? Because from a lifestyle perspective, we talk about things like nutrition, our body, our mindset. How do we bring all these pieces together to make it really tailored for a specific individual?
Yeah. And that is the key. It does have to be all of those pieces coming together, and it does have to be self realization, self actualization. But sometimes it does take talking to a professional about it because a lot of people may not understand the effects of some of their lifestyle choices on their health. A lot of people don't understand in the weight loss world, for instance, that your sleep plays a huge role in what type of results you're getting with your weight loss. So when they come to me and we start talking about some of these things and realize that these are the factors that are affecting your weight, that's what's really important. Talking to somebody who is a professional in that area, talk about your symptoms, and then come up with a treatment plan together based on all of those things together. So yeah, it does take that two-way communication.
What do you believe are some of the common misconceptions or challenges that patients face when they're trying to incorporate lifestyle changes for better health?
Oh, there's so many. But the main one I hear a lot is I don't have time. I get it, right? Time is my most precious commodity. But going back again to figuring out what are your priorities, we somehow find the time to watch Netflix at night or scroll on social media. But when it comes to logging food or going to the gym, I don't have time. So I think we make time for what we consider our highest priorities. I did this time tracking spreadsheet a while ago, and it was 2 days for 2 days straight. Every 15 minutes, I wrote down everything that I did in the day. And I'd really encourage you to do that if anybody's kind of looking for more time in their life, because boy, did I find it. When you really go back and analyze what you've been doing all day long, I feel like I'm busy as all of us do, but there are many times that I may have just been wasting that time. And you start to realize that when you really put it into practice. So I guarantee it'll open your eyes and make you realize how much time you might have that you didn't even realize.
Yeah,
So time is a big
we use this term "I'm busy" quite a lot, don't we? I think we have to
one.
do a little bit of self-reflection around that too. Busy versus productive or
Right.
efficient. The concept of busy sometimes can have a negative connotation too. I think it's more about, like you said,
Yes.
being productive with that time. And doesn't mean you have to
Yes.
go out and achieve something. Maybe it's just that time to just do a bit of reflection and think about what
Yes.
is happening with me within my body.
Yeah, the reflection, I think that that's the most important thing, right? And figure out what it is that's going on. Because sometimes we also make up stories in our head that something's going to be or take so much more time than we really realized. And then when you start thinking about what is actually needed, maybe in your mind, going to the gym is just too much and you don't have the time for that. But when you kind of break it down and say, well, I have that bike that's been sitting for so long and I have some free weights at home. Maybe I can incorporate 10 minutes in the morning, 10 minutes in the, afternoon, and I get a 20-minute workout done that day, right? So again, that self-actualization and kind of realizing what is really needed, how I can get it in. And maybe I don't have time for the hour at the gym, but I might have time for the 20 minutes. So I think it really self-reflecting really does help you figure out how to accomplish your most important task.
And what's your take on consistency?
I think consistency is the key to so many things in life, and especially when it comes to our health. You don't have to be perfect. I love telling my patients it's not perfection, it's progress that we want to aim for, right? It definitely takes time to do these things, but just making sure that you're consistent with your habit. It can be small habits, but as long as you're doing them every day or every other day or whatever your plan is, it's that consistency that is really going to get you the results over time. And that has to definitely do with our health. So if you're trying to, improve your nutrition, it doesn't have to be black or white. It doesn't have to be all or none. Maybe you do little things at a time. You make a few changes, but you're consistent with those few changes. You're consistent. And then you add on a third change, maybe a few weeks later, and you add on, changes as you go. But staying consistent is really the key. Even with weight loss, a lot of people think that I can just lose weight and then I'm done, right? I don't have to do anything else. But again, it's a lifestyle change. We have to be consistent for life. It's not a diet. It's a lifestyle change. That's the only way to keep off weight long term and keep your health in check long term is to follow these micro habits, make them your daily habits, and be consistent with it. So, very powerful term, I think, consistency.
And you talked about lifestyle change in the context of weight loss. Nutrition is a big one in that. And the education around nutrition is really important too. Lots of people always say, oh, I'm really eating really well and I'm doing what I need to do. I'm tracking calories. Is that the focus? Or is it more around education of what's actually going into your body and where those sources of food are coming from versus tracking the data?
So I think it's very individual and I think it can be any or all of those things. For a lot of people, we first need to start off with just being mindful of what we are doing, especially with nutrition. What are we putting into our bodies? Most people can't even recall what they had for dinner yesterday because we're not paying attention. We're not being mindful. It does start off with being very mindful about our choice, being mindful about the timings, and again, being consistent with those timings because nutrition is so much more than just what we're putting into our bodies. It is what we're putting into our bodies for sure. It's also the timing of when we're putting it into our bodies. It's the amounts of what we're putting into our bodies. So sometimes logging and those types of things can really help you understand what you're eating, help you be more mindful about the foods you're putting into your body. So I think, paying attention to all of that is important, not just going on a diet, right? Because that's not taking into account everything else that you should be focusing on as well.
So you mentioned timing when you're putting things into your body. I'd love to tap into that a little bit more. Can you give some real breakdown examples of when you say timing and what you should be putting into your body when and the science behind that?
Yeah, I love that question. So, timing is so important because, we talked about consistency before. Well, our bodies are made for consistency. That is how we stay healthy. Our bodies really love the regular pattern of eating and fasting. And so it is very important that whatever we choose, we're doing it properly. Now, intermittent fasting is a common thing that a lot of people are doing. And all that really talks about is the timing of your eating. You can do intermittent fasting or you cannot do intermittent fasting, but whenever you eat your first meal of the day, that is your breakfast. Whatever food and nutrition you're putting in the first of the day. And for a lot of people, that's just coffee with cream and sugar. That is your breakfast. So, your clock starts when you're putting that first nutrition in your body. And for some people, it's 6 o'clock in the morning. And for others, it's 12 p.m. It doesn't matter. But that first meal of the day does need to be a nutritious meal. We want to do protein loading. We want to make sure that that initial meal has plenty of protein, lean proteins. Don't forget the plant-based proteins like beans, lentils, legumes, edamame, nuts, seeds, along with your lean chicken, turkey, fish. But that protein, I think, is so important, especially that first meal. And then kind of planning it out and seeing when is my next meal going to be and when is my next meal going to be. And some people do 3 meals a day. Some do 3 meals with 2 snacks a day. Whatever it is, plan it out. Have a regular, consistent schedule on most days of the week. And then the other part that's important in timing is when you finish eating for the day. That's just as important because some people finish at dinner time and other people don't finish until right before bed, right? So that timing is incredibly important as well because the food that you're eating, and especially if it's not the healthiest of foods, can really affect your blood sugar in the morning, or it can affect how you're feeling. You might get some acid reflux and it prevents you from getting good quality sleep. So we ideally say don't eat at least 2 to 3 hours before you're going to lay down. And so that should be your cutoff time. Find out when you're going to bed. And then 2 to 3 hours prior to that should be your cutoff time, except for sips of water. I actually don't even think you should drink tons of water before bed because, that can affect your sleep, but maybe make you wake up in the middle of the night because you have to use the restroom. I think that stopping your meals a few hours before bed is incredibly important as well. And then giving your body that time to rest until your next meal. So after dinner, giving your body that time to rest until your first meal of the day the next day gives our bodies and our livers time to reset, and our gut bacteria. We talk a lot of microbiome. It's very important. Those are the healthy bacteria in our gut, and they need time to rest, just like we need time to rest. So giving our bodies a rest is incredibly important. So that's why I say, timing is crucial with your meals.
You mentioned gut health. Can you share from a scientific perspective, how does gut health actually help with holistic well-being and vitality?
Yeah, this is a really growing area, and there's still so much research to be done and so much for us to learn. But what we do know is that these trillions of bacteria that live in our gut are good bacteria. We needed them there. They help us be healthy in so many different ways. Connection with the gut to many different areas. You get our mental health. When you're nervous, you get like this feeling in your gut, right? It is connected to so many different parts of our bodies and brain. And so it makes sense to keep our gut healthy by eating well, lots of fiber. The gut bacteria love fiber. So keep those bacteria healthy. We know that things like taking too many antibiotics can really deplete the good bacteria. It's one of the reasons as doctors, we don't give antibiotics for everything. Patients a lot of times do want antibiotics. They go and get their own sometimes from places, but we're very cautious about that because it can do damage like this. It can strip your good bacteria from the gut as well, overdoing it with certain antibiotics. And so being cognizant of that, we want a good balance between the good and bad bacteria in the gut. And when the bad bacteria takes over, then we get a lot of GI related complications, abdominal pain, bloating, gas, diarrhea, constipation, but also so many other parts of our bodies can be affected as well. So it's very important to pay attention to our gut health.
I know you mentioned it's very individual. How do you incorporate some of the things that you just shared around gut health into your approach and philosophy?
That goes back to my practice philosophy of incorporating lifestyle with traditional medicine, where we need to focus on all of those areas. We need to focus on nutrition, on your physical activity, on your quality of sleep, on stress management, right? Are you drinking a lot of alcohol or smoking? Some of those substances that can be really detrimental to our overall health. It all ties together if you really think about it, because what's good for our gut is also good for our weight, and it's also good for our heart, and it's also good for our brains, right? So it all is the same things, but it's really becoming aware of it and then individually working on it because every single person I work with has a different story. They have a different lifestyle. So then they're going to have a different treatment plan. We're going to work on different things based on what their needs are.
Stress can impact all internal systems, not just our nervous systems, but our digestive systems too. How is that managed, and what is the impact of stress within our approach to overall well being?
Okay, so now you've hit on one of my favorite topics, stress and sleep, because I think that and they go hand in hand, right? Because if your stress is high, you're not going to sleep well. And if your sleep is bad, you're going to have more stress. And in our society, in our world, as we talked about earlier, everybody being busy, everybody is also stressed out. And, I think stress is really an important thing to focus on because there can be good stress. This comes from our ancestral days. So the cavemen, when they were faced with an oncoming buffalo, their cortisol and adrenaline levels would rise so that either they could fight or flight from the buffalo. And so they would do one of those two. They would fight or they'd flight. And so they got their exercise, right? And then guess what? That helped those stress hormone levels come down. In our day and age, we're not getting enough of that exercise and our other habits are bad as well. And so what happens in our bodies is those levels like cortisol, insulin, epinephrine, all these hormones are just high all the time. That then leads to all of these physical and mental manifestations. So stress really does play a huge role in almost everything from head to toe. And sleep then goes along with all of those things as well. Because if you're not getting good restorative sleep, nothing that you're doing is going to work if you don't get that restorative sleep. The sleep ties it all together.
So, speaking of sleep, what's the recommended amount of sleep that an average adult should have? And you mentioned restorative sleep. Could you also just share what that actually means too?
Yeah. So recommended for adults is 7 to 8 hours of continuous sleep. So when we talk about sleep, we talk about quantity and quality, but they forget about the quality of sleep. So when I say restorative sleep, I'm talking about that quality sleep where you want to be able to stay asleep for those 7 to 8 hours. If you're waking up in the middle of the night, your sleep is being disturbed and now your sleep cycle has to start all over again and there's no way you're going to get another 7 hours right after you wake up in the middle of the night. So we want the sleep to go through its normal phase, the cycles you need to for it to go through it for 7 hours at least. And that is where all of our bodily processes, a lot of different functions happen. It happens in that deep sleep where we're getting that restorative sleep for 7 hours. For kids, it's incredibly important too. This is when growth hormone is released. It's released during that time. And for adults, this is also when our hunger hormones are released, our stress hormones are released. So if you're not getting that sleep, then you're having higher levels of things like hunger hormone, insulin, stress hormones. When you're getting the good quality restorative sleep, then you're suppressing those things. So it can help us stay on track with our nutrition, help us with our weight loss efforts, but just overall long term, it helps our metabolic health. So it helps your body function properly, prevent diabetes and heart disease by getting that good quality sleep. Not to mention brain health, incredibly important. Lack of good quality sleep is associated with dementia. A lot of people don't realize that it's related to memory loss and dementia. Have you felt like you may not be able to focus, concentrate, or you're forgetting things? Look at your sleep. Are you getting good 7 to 8 hours of continuous sleep at night? Because if you're not, then start with that. Start with that first and foremost. Doesn't matter what age you are. All of these things can really help us live healthier longer so they can help improve our health span, not just our lifespan. And I think that sleep is just so crucial to all of that.
That's such a fascinating topic. And you mentioned individuals starting with that. How can
Mhm.
individuals outside of the sleep stay motivated and committed to long term lifestyle changes, especially when they face setbacks or challenges along the way?
Yeah, it is tough because this is a lifestyle change. So we have to stay on track as much as we can. Again, we're all human too. We're not robots. So we're not going to be perfect for the rest of our lives. We have to kind of give ourselves some grace with that too. But I think one of the first things is to start with determining your why. One of the first things I tell my patients when they start my program is let's understand the deeper reasons behind why you want to achieve this effect, whether it's weight loss or are you trying to fit into your dress? Are you trying to prevent heart disease? What are your whys? This is going to help you really understand and keep you motivated long term. I encourage you to write it down somewhere, post it somewhere where you can see it regularly, and keep going back to it, especially when you see yourself falling off track. And then set achievable goals and have realistic expectations too. Sometimes we fall off track because we have unrealistic expectations. I have people come to me and they say that they were trying to lose 50 pounds in a month and they just couldn't do it. And well, of course not. Aim for a more realistic, achievable goal. Aim for 1 to 2 pounds a week. Can you achieve that? Yeah, you can probably achieve that if you're focused. So set your achievable goals and then celebrate your successes along the way. Don't just focus on that big number at the end. Keep your focus on the process, not the end goals. If you've met that 10-pound mark, reward yourself. If you met the I got rid of my blood pressure medications mark, reward yourself and reward yourself with non-food items. Maybe, get a massage or a new outfit that you've wanted or a certain tech gadget that you've been eyeing. Reward yourself and celebrate what you've done so you can keep track of that. I had a patient for over a year and she was down 56 pounds. But more than the number on the scale, I care about other factors. She had improved her blood pressure, her pre-diabetes had gone away. She was just feeling better, moving better. But in her mind, she had set this BMI in her mind and she wanted to reach that BMI. So when she saw me, she was just discouraged and upset. We really sat and had a long talk about all of her non-scale victories. And I think it really helped shift her mindset and actually start to appreciate her body for all that it had done so far. And I think it helped her get back on track. So I think it's important to focus on the positive things you have done right. Yeah.
And speaking of appreciating your body, the brain, the whole holistic piece, what are some practical tips and strategies you think our listeners can take away from today's conversation to start creating these healthy habits into their daily routine?
Yeah, good question. So I think first, start with that self realization piece. Look at the pillars, look at your nutrition, look at your physical activity, your sleep, and your stress levels. Start with those. What are there certain changes that you can make? And again, it doesn't have to be perfection. We're aiming for progress, not perfection. So maybe some small changes, but be realistic about it. You've heard the term SMART goals, the SMART, specific, measurable, attainable, realistic and timely goals, right? Make those types of goals for yourself and then look at it and follow that. And when you're looking to achieve a goal, and if it's something like weight loss, don't just focus on the number on the scale, right? As I mentioned earlier, there's so many other factors that are more important. If you want to look at numbers, look at your blood pressure numbers, look at your blood sugar numbers, look at your muscle mass numbers, right? Your body fat percentage and the visceral fat, the fat around our waist. Those types of numbers. Those are numbers that are way more important than that number on the scale. And find things that you find joy in. So if you hate exercising, is there something that you do love to do? Do you love to take walks with your family? Maybe that can be a form of exercise for you. Do you like to play tennis? Maybe you used to love to play tennis. You don't do it anymore. Maybe take that up again. So find things that you find joy in and don't beat yourself up. I think the big thing is give yourself grace. We all make mistakes. It is okay. But the biggest thing is we just need to get right back on track the next day. Just because we made a mistake, it is okay. Get right back on track because it's the long game that we care about.
That's awesome. What a great conversation. There's been so much in here, Dr. Desai, around what we could probably start doing, focusing on our why, making sure that there's engagement, education. Thank you so much for joining us today. And I really hope that our listeners are able to start doing some of these things too. I think it's really important that we're taking care of not just our bodies, but our overall well being too. So thank you once again.
Thank you so much for having me. It's been my pleasure.
Well, thank you, everyone. Thanks for joining another episode of Limitless Lives. Talk to you soon.